Well, many of you may be familiar with what is called the tax identification number, or referred to just commonly as TIN. It is an 11-digit identification that the Ghana Revenue Authority requires all taxpayers, including myself, to have to ensure tax compliance. So, any Ghanaian without this number from now cannot get, among others, a driver's license, for example, a bank account or a passport. But in spite of assurances by the Ghana Revenue Authority that it has sensitized the public on this subject, it appears not many Ghanaians are aware of this new policy. Kobladum has more.
For decades, successive governments have stressed the need to widen the tax net in Ghana as a means of generating more revenue for the state to fund developmental programs. Well, the NPP administration believes the implementation of the tax identification number system will help to do just that. And beginning this month, the Ghana Revenue Authority will be enforcing the policy to ensure all Ghanaians adhere to it. It is a process requiring only one's particulars, that's date of birth, age, residential address, and the like. One needs it to transact even the basic activities such as acquiring a passport.
You cannot clear goods from the ports, register your land document with the Lands Commission, obtain a tax clearance certificate from the GRA, register your company at the Registrar General Department, obtain payment for jobs, contracts done for government. You cannot file a case at the courts, nor bid for contracts from government agencies.
This, according to the Commissioner General of the Ghana Revenue Authority, Kofi Nti, is a way of broadening the tax net to be able to monitor all individuals, both in the formal and informal sector, in terms of the transactions they make.
The Revenue Administrations Act, RAA 2016 Act 915, gives legal backing to the TIN. The TIN is an 11-digit unique number given to identify you and enable GRA credit to you whenever you pay your tax. Effectively, it is to capture all potential taxpayers.
But how much would it cost the individual to have this TIN?
I wish to reiterate that registering for TIN comes at no cost to the taxpayer.
The authority says it has collaborated with all relevant agencies to ensure the enforcement of a policy.
On the sensitization issue you raised, we are getting collaboration with the NCCE and then the ISD so that our outreach to the communities will be enhanced. But so far, we've done enough in that area.
It appears many of the Ghanaians around the country do not have an idea about this particular implementation of a tax identification numbers, which is being implemented across the country today.
We have heard about it, but there has not been much education on it. So I think they should educate more, do more education on it so that everybody will come to terms to it. What I've heard about it is that now it is a must for every Ghanaian to get a tax identification number. With me, I don't have much problem with it because I know that as a citizen, you have to be able to pay your tax, file your tax returns and stuff. But I think the masses, how we be able to get them along so that we all build a better nation. That is what is at stake.
I heard about it about 3 weeks, close to a month ago or something. But really, I don't know more about it. As in, we are not being educated in a whole lot of things. So it's like, it's very new to a whole lot of people. I didn't know you asking me, telling me it's starting from today. I didn't know all about this. They should educate us more.
Sports this morning and my dad was telling me about it and I was like, it's not a good thing that much because some of us not working and wanting to apply for a passport is going to be a problem. So they should try and do something about it.
So what did he tell you about it?
He told me that you need, before you have to get a passport, you need a verification from the tax to show that you're a taxpayer and stuff before you can apply for. And it didn't sound well though.
But you know that getting this particular pin is free. You just have to go to the GRA, get a form. Do you know that it's free?
No, I never knew about that.
Okay, so frankly, you hadn't heard about it until your father told you about it?
Until he told me about it, I never heard.
Now, the Revenue Authority are saying that you only walk to their offices, get a form, where you have voter ID number and those particulars that you have to fill. Once you fill that, then they issue you with a number, and that is the number you use when you want to go and do anything.
If it wouldn't, it's not going to be a great going through hell to go to get that. It's okay. But if it's going to be a problem, you having to go and you keep going to come, then that one will be a different problem altogether.
Well, there could be shortage of fuel in Ghana soon, and that is according to the Senior Staff Association of the Bulk Oil Storage and Transportation Company, known to many of us as BOST. The association is blaming the activities of a cartel of bulk oil distribution companies, or BDCs, for what they describe as the imminent shortage being speculated. In a statement, the association accuses the cartel of influencing the rapid increase of fuel prices under the guise of deregulation. Away from all the subject about fuel, etc., JoyNews has already learned that the man whose injections led to the death of some 4 persons at the new Senchi Health Center has been arraigned before courts on the charge of murder. Health officials in the eastern region, they've already revealed that the suspect was operating a private clinic at the facility. The victims had gone to the facility reporting of skin infections, but the retired disease control officer, James Yeboah, is said to have administered contaminated injections. According to the sources, even though he had retired some 6 years ago, he used the facility for his private gain. We're still remaining in the health sector, and some nurses and patients at the Tamale West Hospital, they're raising red flags over a dilapidated structure they operate in. They currently say they put their lives in preventable danger each day they walk into the building to undertake their duties and also access health care. They are concerned another facility that could serve as the outpatient department is rather locked, though completed. Matilda Bugri now reports.
Tamale West Hospital is a strategic facility providing health care service to patients within the Tamale metropolis. Averagely, the OPD receives about 500 patients, but with the deep cracks further deepening, the staff in the facility fear they may be risking their lives. One of the nurses spoke to JoyNews.
The cracks are causing danger to staff and clients. Because as you can see, we can't tell when disaster will fall on us. And we are working in an environment, in a frightened environment. We can't really tell what will happen next. When it rains, there's thunder, the building vibrates. The foundation is weak. The cracks have gone all the way down the foundation. So it's a very risky place to work.
The patients who visit the facility do not only see the building collapsing in the near future, but also fear the danger lurking around the building. Mohammed Abdul Kader has a relative on admission who had told him that some days ago a snake tried entering the building.
I'm not feeling very comfortable. But looking at the grass, the place is now in death trap. But what can we do? It's responsible to the hospital or the ward. The grass alone can cause more harm to the patient and even the patient. You look at the floor that as you can see are retired. But the cracks alone, we are living with reptiles, other animals, and our place of disposal of other materials are just among the patients. So we are appealing to the authority to look at it and see how the best they can solve the problem for that. The hospital is, that was 2 days ago when I came to visit my patient. He told me that there was a snake at the house trying to come in.
A patient, Ayuba Zakari, described the place as a death trap. Meanwhile, private developers have also encroached on the land of the Tamale West Hospital. What started with movable kiosks and containers has now graduated to the building of permanent structures. The secretary of the Concerned Nurses Association, Hanan Confidence Abdul, says the hospital initially planned to use the encroached area as lawns, but that purpose has been defeated.
Because usually when you build on your boundaries, you need 7 feet. The hospital initially planned using the outer space for lawns so that it could give the hospital some aesthetic value. And if you assess the situation as it is now, you realize that the entire boundaries of the hospital is very clumsy.
The hospital atmosphere is also not conducive as noise pollution from encroachers is high. Mr. Confidence Abdul appealed to the mayor of Tamale to intervene and help the hospital relocate the illegal settlers.
And first of all, some of their activities, one way or the other, may create some kind of discomfort or pollution, noise.
And that's it for the roundup of news we have. We have a lot of news as we do a review of the newspapers. Myself, Mama View Sobwajo, will be looking at the various online portals, myjoyonline.com, foremostly, City Newsroom now. And then also we'll be looking at the latest headlines on the BBC. Please stick and stay.